Good morning, pregnant mamas. Today I want to talk to you about symphysis pubis dysfunction, or SPD. SPD is really common during pregnancy. About 1 in 4 women get it. It happens when your pelvic girdle is moving at a faster rate than you want it to, which creates a little bit of imbalance and can create discomfort down there. So here is your pelvic girdle. So you've got your hip bones, you've got your sacrum, your coccyx, and at the front here, joining your hip bones together, is your pubic symphysis. So what happens during pregnancy is this bone is supporting your top half to your lower half, but you're getting a lot heavier, which puts a lot of extra strain and weight on this area here, which can cause these bones to move a little bit. And it kind of gets you ready for pregnancy. Your body is absolutely amazing. You've got some great hormones like relaxin moving around that body so that these bones can loosen up and just get you ready for birth. Now that's all great, but sometimes it happens a little bit too early. So you can start to feel this pain in your second trimester, which creates a lot of imbalance on the body, and especially when you're walking, rolling in and out of your bed, going upstairs, you can feel that pain, and it creates a lot of tension, and it can actually be quite painful throughout your pregnancy. So today I'm going to show you a few exercises that can help you alleviate the pain, strengthen your pelvic floor muscles, your inner thigh muscles, your glutes, and your lower back, so that you can still move around comfortably during your pregnancy. So let's get started with the exercises. At the end of the exercises, I'll give you some tips and tricks to help you throughout your day during pregnancy. Let's get started with some bird dog. So on your mats, you're going to come onto your hands and knees, so on all fours. Your hands are directly under your shoulders. Externally rotate those hands ever so slightly. Your knees are hip width apart. Just take a few breaths here to get into the moment. So just shake it off and inhale, big belly breath out. Exhale, your belly comes in. Inhale, belly comes out. Exhale, your belly comes in. I want you to go ahead and give me a nice big butt here. Inhale, exhale, tuck in, and then just find your middle ground. So find your middle ground so your back is nice and straight. Now we're going to inhale. Exhale, reach out. Opposite arm to leg comes out. Inhale. Exhale. Squeeze the glute, reach the arm out in front. Inhale. Exhale. Two more here. This is great for the lower back, great for your glutes, which is all supporting your hips. So now we're just going to shake it off. We're going to do 6 more here, but this time on the inhale, you're going to relax your pelvic floor. So just relax, let everything down there, just let go. And on the exhale, you're going to contract and just ever so slightly tighten that pelvic floor. Okay, it's not a big movement, it's very subtle, and you're going to feel a slight lift in your pelvic floor. So you'll know it when you're doing it. Okay, so shake it off. Let's go. Inhale, relax the pelvic floor. Exhale. Pull up. Inhale. Belly comes out. Exhale. Contract that pelvic floor, squeeze the glute. Inhale. Exhale. You can add a little hissing here if you want on the inhale. Exhale. Just a slight tug in the pelvic floor. Last one. And release. Shake it off. You can come just into child's pose, making room for your belly. Reach out. Okay, exercise number 2, we're going to go into some pelvic rock. So again, starting on all fours, hands directly under your shoulders, knees nicely hip width apart. Shake it off just to start. These pelvic rocks look a little like this. So Your butt's going to come out like a big butt, and then you're going to tuck in your pelvis. So they're just tucking your pelvis in and out. It's a very small movement. It's not over-exaggerated. You don't want to over-arch your back at any point as well. So just a little small tuck in and out. As you're doing the inhale and exhale, inhale, you're going to relax your pelvic floor. Exhale, you're going to contract and pull up. And that slight tugging sensation again in your pelvic floor region is going to happen. So let's go. Inhale. Exhale. Pull up with the pelvic floor. Inhale. Exhale. Inhale. Exhale, pull up, tighten the pelvic floor, tight, tight, tight. Inhale, relax everything. Relax all your muscles. Exhale. This is also amazing for lower back. Inhale. Exhale. And relax the pelvic floor. Push those hips back. And exhale, tuck in, tuck in, tuck in. 2 more, let's go. Inhale. Inhale. And release, shake it off. All right, we're gonna come on to our backs, guys. If you're later on in your pregnancy, you can skip this exercise, or you could even just do it standing. So here you wanna have quite a neutral stance on your back, so you don't want to be over tucked so that your pelvis is tucking too much under, but also you don't want to be under tucked that you've got a massive gap here. So just find your neutral baby, okay? So just you can push back so you have too much of a gap, have less of a gap, and then find that middle neutral ground so that you're sitting nice and comfortably. Okay, so here you're just going to inhale, belly is going to come up. Exhale, you're going to pull in your pelvic floor and you're going to hiss. Pull up, 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 up. Inhale, belly rises. Relax the pelvic floor. Exhale. Inhale, relax your pelvic floor. Just let go. Exhale. You feel that slight contraction. You're pulling up, up, up. Inhale. Exhale. We're going to do 4 more here, but we're going to add the pelvic tilt. So inhale. Tilt your pelvis so your gap becomes a little bit bigger here. Exhale. Make the gap smaller towards your mat, pulling up, up, up with that pelvic floor. Inhale, belly rises, relax. Push the bum back, tilting the pelvis back. Exhale, hiss. Find that neutral. 2 more, guys. Inhale. Exhale. Tight, tight, tight. 1 more. Inhale, relax the pelvic floor. Tilt those hips back. And exhale. Awesome job, guys. Remember to get up nice and safely on your side. Okay, the next exercise we're going to do is we're going to do a nice chair pose. Okay, we're going to use a ball. You can have a small ball like this. You can use a kid's ball or a pillow, yoga block, anything that will go on the inside of your legs. So, popping the ball in the middle of your legs, you want your feet about hip width apart. You're going to come down into a nice chair pose. You're going to push your bum back as if you're going to sit onto a chair, and you're going to squeeze the ball with your inner thighs at the same time, okay? So inhale, you're going to come down, and as you're down there, you're going to exhale and squeeze, squeeze, squeeze that ball, okay? So shake it off, inhale, exhale, squeeze the ball as much as you can, and back up. Inhale, belly comes out, you come down as if you're sitting on a chair. Exhale, squeeze those knees together, make sure your back is nicely aligned and you're squeezing, 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 squeezing. Back up. Inhale. Exhale. Tightening that pelvic floor. It's a very, very slight lift, but you're doing the pelvic floor, you're squeezing the knees, your back is nice and straight, shoulders are down. You've got 3 more here. Inhale. Exhale. Squeeze. Pull up. Inhale. Last one, guys. Make it a good one. Push, push, push. Up, up, up. And release. Shake it off, guys. Grabbing your ball again. We're going to do a similar exercise, but against the wall. So what I want you to do is find a nice wall in front of you here. You're going to walk down, pop the ball in between your legs. You don't even have to use a ball if you don't have one. You can also just squeeze your knees together, and that will be enough. Feet hip width apart. Gently walk down your wall. So you got a nice 90-degree angle. My back is nice and straight here. And you're just going to inhale. And exhale, squeezing the ball with your legs. Inhale, relax your knees. Exhale, squeeze the ball. Nice and tight, tight, tight. Inhale, relax your knees and your pelvic floor. So everything is nicely relaxed. Exhale, pull up your pelvic floor. Squeeze the ball together. Squeeze, 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 squeeze. Let's do 3 more here. Inhale. Relax the pelvic floor. Exhale. Contract the pelvic floor and squeeze those knees, ladies. Squeeze those knees. Inhale. Exhale. Lift up, 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 up. Last one, inhale. And exhale. Slowly walk your hands back up and grab your ball. Next one is going to be on your mat. So getting safely down onto your mat. We're going to be doing some hip thrusts. So start by lying on your back. If you are later on in your pregnancy, I will show you in the corner of this video a little adjustment to this exercise so that your back can be raised. Pop the ball in between your legs, feet hip width apart, hands by your side. Relax everything to begin with. You're going to inhale, your belly's going to come out. Exhale, you're going to pull up with the pelvic floor, pulling up with your hips. Now, notice how my ribs are in, okay? They're not flaring out and they're not pushing out. I'm not overarching my back like so, okay? You want to keep that tightening in those ribs, keep them coming together. So no flare out in that rib, okay? So 3, 2, 1, let's go. Inhale. Exhale. Pull up with the pelvic floor, squeeze the ball so you get the inner thigh squeeze. Your glutes are on as well, and your ribs are nice and tight. Inhale. Relax. Exhale. Squeeze that ball. Make sure that core is tight. Pull up that pelvic floor. Inhale. Exhale. I always like to start with pulling up with the pelvic floor, then pushing through with the knees. And of course, once I've pulled up with the pelvic floor, inhale. Correctly, exhale. Then I know that my ribs are in place, because I know it's a lot to think about. Inhale. Exhale. Pelvic floor, knees squeeze, squeeze, squeeze. Your glutes are on. Inhale. Exhale. It's a very tiny movement, and it's the same with what's happening inside with your pelvic floor. Nothing is aggressive. It's a slow burner, a nice slow strengthening exercise to support your pregnancy, okay? You don't want anything to be over-aggressive, overactive. I have lost count, so let's do one more here. Inhale. Relax the pelvic floor. Exhale. Pull up, up, up. Squeeze the knees. Tighten the glutes. Check your ribs. And release. So here are some tips to help reduce the aggravation of SPD. Number 1, see your chiropractor, physician, or doctor. Number 2, you can ice the area. So icing the area just with a cold pack of peas can help reduce the inflammation, and that can help reduce your pain. 3, when you are walking up and down the stairs, sometimes it's great to walk up and down the stairs very slowly and on your side rather than head on. 4, avoid standing on one leg. So especially when you're getting dressed, standing on one leg, that can cause a lot of pain. Sit down like so and then pop your trousers on. Especially when you're getting in and out of your car. So that leads me on to the next point. When getting in and out of your car, you want to be moving like a mermaid. So keep your feet nicely together and you want to swivel in and out. Sometimes I find that putting a plastic bag on the seat of the car can help you swivel in and out of your car. When you're in your bed, you want to be moving by keeping your feet nicely together, squeezing those knees together, making sure that your legs are not opening out wide. And lastly, when you're doing exercise, avoid most one-legged exercises, because this is going to cause a lot of aggravation on your legs. So especially when you're standing on one leg and you're holding a weight in your hand, weight-bearing exercises, this is going to cause more aggravation for you. So stick to 2-leg exercises at all times. Thank you guys for joining. There's so much movement that you can do even if you have SPD, so don't stop moving. Just focus on exercises that are non-aggressive, that support your pregnancy, and that strengthen and lengthen those muscles surrounding the area that's causing you discomfort. If you like the videos, please keep tuning in, because I've got loads more coming.